Hello and welcome to the Behavioral Health Matters podcast with Magellan Behavioral Health of Pennsylvania. This is the show that aims to promote positive mental health, increase our understanding of behavioral health topics and services, and reduce stigma. I'm your host, John Lees, and I'm the member and family advocate at Magellan Behavioral Health of Pennsylvania here in the Lehigh Valley. On this episode, we'll be learning about Pennsylvania's Rehabilitation and Community Providers Association, also known as RCPA. We'll learn about the organization's history, mission, ongoing work, and future goals, and we'll do this with the help of our special guest for this episode, Richard Edley, President and CEO of RCPA. Richard is the lead executive for RCPA and responsible for all aspects of operations and direction for the association. During our conversation, we'll learn about the history of RCPA and the work they've done to support providers and advocate for policies to help those in need. We will discuss their efforts to advance effective state and federal public policies and how they serve as a forum for the exchange of information and provide support to their members. We also discuss RCPA's annual conference and get a preview of this year's events. Stay tuned at the end of this episode to learn how you can provide us with your feedback about the podcast and make suggestions for future episodes. And now here's my conversation with Richard Edley. Welcome to the podcast, Richard. We really appreciate your willingness to join us for this episode.
Absolutely. Thank you so much for having me here today.
So, if you would, we'd like to usually start by introducing our guests to our listeners. So if you could maybe share a little bit about your background and also highlight your current role with RCPA.
Sure. I'm a clinical psychologist by background. Been a few years since I've practiced. I've really been more on the administrative side for many years. And for a number of years prior to taking this role with RCPA, which I'll explain in more detail, I ran a behavioral health managed care organization in the Commonwealth and really have a long-standing history of background within behavioral health managed care. In terms of RCPA, I'm the president and CEO, and I've been doing this for about 11 years and really grown the association, which we can get into, and stands now as really one of the largest and most diverse provider associations in the country. We represent almost 400 agencies and organizations across 9 divisions of health and human services today.
So that's a great place to jump off into the organization overall. If you could you tell us a little bit about the history and the mission of RCPA? And if possible, if you can speak to how the organization has evolved and adapted to changes in the healthcare landscape over the years to where you are today.
Sure. Well, when I started with RCPA about 11 years ago, it was really through the merger of 2 historical associations. And our base mission is to represent community providers, which are often referred to as the public safety net providers, those who are doing Medicaid work and other things like that, with those with the most serious and severe disabilities. But we also realized that there could be some real strength in diversity and size. So our real sort of unstated mission is that we wanted to become the go-to organization. When I say that, I mean for like legislators, the administration, the governor's office. So when issues around health and human services come up, but mental health, substance use, intellectual and developmental disabilities, and so forth, people, leaders would think of RCPA and want to come to us for our opinion and for our members' opinions. And that's really why we're a little bit different than some other associations around the country that are a little more focused, a little smaller. And while there's advantages to that, we really wanted the size and diversity. And when you talk about changes to the healthcare landscape and how is RCPA adapting these changes, again, going off on this sort of size of our organization, we also wanted to be a more proactive force. For example, I mentioned legislation and the legislature a lot. We didn't want to just react to what's already been proposed and then try to figure out what we're doing. But what if we, on behalf of our members, were able to propose better legislation or review legislation before it's enacted. Same with the departmental policies. For example, within the Department of Human Services, if different policies are being discussed, shouldn't we be at the table as representing the providers and be able to influence some of that? And when I say influence, I mean in a very positive way. Often what we see in legislation and policies are what we would call unintended consequences, all well-intentioned. But when enacted, do you realize what will be the downstream impact of that? And we'd like to be able to be proactive in doing that. The other big change, obviously, in the healthcare landscape, you can't talk about changes in healthcare and not talk about workforce. And really, among the few things we've learned through the period of COVID, and now I guess we're not fully out of COVID, but certainly in a different phase of it, is the ongoing workforce crisis in health and human services. So again, using the same kinds of solution, how can we be more proactive and looking not just at funding, but in relieving administrative burden and things like that, which do impacting the legislature and the administration and the governor's office. So those are the kinds of things. The last thing I'd say about the healthcare landscape, and this also, a lot of it came out of COVID, is the importance of new innovations like telehealth and artificial intelligence and new funding methodologies like value-based purchasing and performance-based contracting, all of which we could get into, but it certainly is different than things were a decade ago.
Interesting. So as you're proposing, as you mentioned, kind of being proactive and proposing, it sounds like a form of thought leadership, really. You would kind of have a view of what some of the priorities and needs are here within Pennsylvania and be able to pivot and then promote and proactively seek out, changes within policy and legislation as a result of that. Is that one of the ways? I'm sure there's many ways, but one of the ways that you would directly support the membership then?
Yeah, exactly. And when I mentioned that RCPA has 9 divisions, each division has a division director, someone who's really expert in that area, who providers can turn to, but so can governmental leaders in terms of understanding the issues better, getting education, and really being a very active, not a passive association. When I think about the changes just to RCPA that I really sought out over the last decade, that's part of it. Let's really pick up the pace and be a force here. And again, I mean that in a very positive way.
Right.
We have a lot of expertise, even of course within our membership. So when I hear at times different governmental committees being set up, the first thing I think of is, we have some members who'd be excellent on that committee. What if I propose that and bring some of them to the table, which we didn't necessarily have that kind of opportunity years ago.
That's really great. So the members themselves, in a sense, are advocating through the organization, and in turn, you're able to make some of those connections. So you really must know that it's a large, as you mentioned, very large organization in terms of the membership, but you must have a very good handle then on who those members are, what each area of focus would be and kind of who those experts are, it sounds like, in order to be able to hopefully get the best possible outcomes.
Yeah, between myself and the division directors, we almost have to have that level of knowledge of our membership. It's a real partnership. When I think about what the members can do for us, they can bring to us different issues. And a lot of the members contact us very often about issues they're experiencing, successes, new innovative programs. So we're on top of that. And then as we're working with the government leaders, as we hear what they're thinking of proposing or different initiatives they have, we could all come together on this. There's really, while it feels often that we're fighting for different things, we're really all on the same side.
Yeah.
Obviously the legislature has to manage dollars, so does the departments. There's always going to be that push-pull. Same thing with managed care. But ultimately, we want the best system possible and the best innovation, the highest quality care. We're all fighting for the same thing. You're just coming at it from a different angle.
Yeah, and may have different constraints depending on the given system that's involved. And some of that is about, like you said, maybe just getting the right people around the table to understand better what some of those constraints or restrictions might be. But with that common goal of, look, we need to move forward for the betterment of supporting the individuals we are, responsible to
to provide services for or support for in whatever our organization is set up to do.
Yeah, and as a quick example, a little later this morning, I'm going to be speaking with one of the leadership from Department of Human Services, just a regular monthly touch base on a number of different issues. And I say that not that because of that, RCPA will win something or move the needle significantly, but it's a process that we want to stay in contact, talk about initiatives, talk about priorities, and so that we're well aware of what we're doing and how we can work together.
Kind of shifting gears a little bit now into some more of the nuts and bolts of what's happening now, so to speak. What are some of your current legislative priorities for RCPA? And maybe if not specific, just generally, how do you mentioned, you kind of touched on this, but how do you work specifically with lawmakers to advance these goals? What are some of the maybe challenges you have and how you guys operate in that world?
When we look at it, each year we create what we call our sort of legislative and administrative priorities. And I combine those because sometimes it's working with the administration, the Department of Human Services, the departments within that group, the Department of Drug and Alcohol, and so forth, or the governor's office, or the legislature, or sometimes all the above. Gotcha. So we create, and it's on our website, that each division has its own set of priorities, because certainly some of the detailed specifics of, say, substance use disorders is going to be different than brain injury, which is going to be different than physical disabilities and aging. So they have their own set of priorities. But across all the divisions, we set out each year to say, we know things will come up and we're going to get distracted and derailed and there'll be other things we have to react to. But in general, what is going to be our focus? And this year, for example, in 2024, as I mentioned earlier, was workforce. And when you talk about workforce, you talk about what are some innovative strategies toward recruitment and retention, but also, let's face it, it's funding. Yeah. I often, half laugh when I hear from leaders saying, okay, well, let's put funding aside. And I always respond by saying, that's a big thing to put aside. Yes. I mean, it does often come down to that. Yeah. But that's one chunk. How do we improve funding for our workforce across health and human services? The second, which is related and is a non-financial piece, is how do we reduce administrative burden? Sometimes that's through regulatory reform. But when I say regulatory reform, I mean that pretty generically.
Yeah.
All of the rules, processes, procedures, how are we handicapping our public, providers that goes sometimes way beyond community standard? And I'll give you an example in just a minute. But so how can we relieve that, which is a non-cost way of improving satisfaction, productivity, recruitment, retention, those kinds of things. And the final piece is something that is increasingly occurring across all our divisions, which is something called value-based purchasing, or VBP. Yep. It's simply put, it's how payers, whether it's government or managed care, can reimburse in an alternative methodology and reward better quality, better outcomes, better metrics. And how can we impact those models to make sure that they're realistic, that they're true win-wins, and that we don't lose the those being served in the equation. So this year, those were the three big areas of focus, and it takes on various different offshoots.
And now, a brief word from Magellan. If you or a loved one are a Magellan of Pennsylvania member and have any questions about services, please visit www.magellanofpa.com for more information. And now, back to the show.
The example I was going to give you, where we talk about regulatory reform and taking a look at that, was in telehealth. And telehealth has been a priority for us for several years. And it really goes, again, back to COVID. We all know that when the pandemic hit, there was certainly some telemedicine going on and some telehealth within human services, but not a lot.
Yeah.
Once COVID came, everyone was doing telehealth. You had to. It was a reality. Yeah. And what we discovered, and I mean collectively as a community, as well as RCPA, is that telehealth works. So that it's been very effective in a variety of settings, technologies, a variety of practitioners, varying diagnoses. and with very high satisfaction, less no-shows, greater access, improved productivity.
Yeah.
But then what we also found was it's sort of an area where people bring a lot of biases to the table. So what I would hear from a lot of payers or legislators who, again, everyone's well-intentioned. No one's a bad actor here, but they would say things like, telehealth has been great, but now it's time to go back. Because we know office visits are, certainly better and more, better outcomes. And I would have to say to them, what data are you using to say that?
Yeah, good question.
Actually, our data is showing that it's as if not more effective. So it's a real education process, and that became a major part of RCPA to show data, to perform surveys, to educate, and we're still working through some federal issues around that.
Yeah, it was, just having been involved from the managed care side of it and as a member and family advocate, a lot of my work is virtual work. And I think what you touch on is really important. It's to understand what the needs of the individuals are. And if there's a way for them to get support that they need, and telehealth is that mechanism, and it's available to them. That's one of the challenges, is making sure everybody has good access to it, I'm sure, is part of that puzzle. But it's also, is it individualized? So to your point, like, what are we looking at in terms of the outcomes and the feedback from those individuals who are utilizing that as a means to get that support? And if they prefer that and they're having good outcomes, then let's promote that and make sure that if we're putting up kind of, guidelines around how it should happen, that makes sense. We do that with a lot of things, but let's balance that with not burdening everyone too much, so that, again, that individual is getting everything they need out of the service. If others want to come in person, obviously that's available to them as well. So that's been, again, just from my own perspective and involvement, it can be very individualized, but if you can remove some obstacles and barriers through telehealth or other means, I think it's wonderful that the organization can kind of have that scope to see it, have all the right people to kind of talk about the impact of it, and then move forward in the most sensible way.
Absolutely. And where it dovetails with my discussion around regulatory reform and administrative burden is that public sector agencies get a lot of rules from CMS federally, and from the state of oversight, and from county oversight, and from different regulatory bodies and the managed care organizations, versus private practice. So when we talk about if you're a social worker or a psychologist in practice, and you're told, oh, you want to do telehealth and you have a private practice, here's what you do, and you're off and running, and then you bill for it. Right. Oh, you're working at an agency that's doing Medicaid, here are the 1,000 things you need to do. Well, it's not surprising. Some people, you know what, I'm just going to do private practice.
Yeah.
And that's a real significant issue. That's a non-reimbursement one. It's just you've made it so beyond community standard that it's a problem. Right. And then where it comes to kind of moving away from telehealth, one of the quotes I always use in terms of recruitment and retention around workforce is when I heard from a mental health agency several years ago saying, well, I just lost another 3 master's level clinicians to Lowe's, Walmart, and Dunkin' Donuts. When that's happening in the field, we've got a problem. So we really have to look at funding, burden, and what can we do to bolster agencies so it's not that situation.
Yeah. So it really sounds like RCPA's role in all of that is to get those inputs, to be actively seeking out that what's going on out there in this field, and how can we position ourselves to move things forward in a way that makes sense, that, again, betters the system, the delivery system, so that still, high quality services, but there's a balance with what we're asking of people above and beyond providing the actual service, kind of hitting that sweet spot, maybe.
Yes. Okay. And certainly we understand the role of oversight and quality monitoring and all those kinds of things. I mean, it's critical. We just have to balance it with, being able to provide the services in an economical and efficient way.
Right. Yeah. That makes all the sense in the world. Okay. So shifting a little bit to other roles, and I know that the annual RCPA conference is coming up on the horizon. And I was hoping you'd be able to share a little bit about the history of the conference, and then maybe even provide a preview of this year's event.
I'm sure. Oh, this year's annual conference is again at the Hershey Lodge. We've been there for several years now. It's September 24th through 27th, some pre-conference events, September 23rd. And we've really tried to bolster this and make this conference sort of the annual event that you don't want to miss. There may be a lot of different conferences and trainings, but this is the one at least you circle on your calendar. And
Yeah.
we have several hundred attendees. We have lots of business exhibitors and all the managed care organizations, lots of state and national speakers. So, for example, the DHS Secretary Val Arkush will be there, as well as many of the deputy secretaries and staff. Legislators attend our events as well. All of the payers will be there. So it's sort of the go-to place, and very interesting national keynotes and plenaries. We also have made sure that while there's lots of educational opportunities, also a lot of networking opportunities, especially in this day and age of Zoom calls and whatever. If there's one thing that people do say they kind of lost, is the ability to just sort of sit down with their colleagues and peers and talk about a few things. You just doesn't happen like it used to. And I mentioned our 9 divisions. All of our divisions have some, divisional meetings and subcommittee meetings and special meetings, but they're almost all virtual now. So the ability to have that discussion and then talk in the hallway has gone. So that conference brings back some of that opportunity as well to review this with your colleagues. But we're very excited about it again this year. We have a great program and really strong speakers, and it's packed. If anything, there's lots of competing presentations, but we really have to do that with 9 divisions. We have to make sure everyone feels that they're getting something out of it. And we also want people to send like their HR directors and their finance directors to the conference. And so you need certain tracks for that, or DEI, diversity, equity, and inclusion. We want to make sure that's covered. It's a lot of different things happening there. It is week long, so it's a big commitment. Wow. Of course, some people do come for a day or two. But we feel like if we can make this a strong enough program, people are willing to put aside the time and say, this is that one time I'm coming out and doing this.
I'm sure it's a lot to organize. And I know you guys do it every year. So just a fantastic opportunity for folks to, like you said, make some connections, get some education, and really have a wonderful experience, it sounds like.
It is a lot of effort. I joke that probably a week or two after the conference ends, already we're saying, all right, for next year, getting right up again.
There's not a lot of time to kind of sit back. There's no off season, I guess, right?
Right. And even that, just to give you an idea of how we interface with our members, we have a conference committee that's really very important to this process to design the program, say, what did we learn pro and con from this year and past years? What do we want to do differently? And ultimately to review all of the different proposals we get. And that's open to all membership. So, every meeting we have, every committee is open. So you could be a business member or an associate member or a county or an MCO and say, yeah, but I'd like to be part of that conference committee. You can. It's not just, well, no, this is reserved for providers. We're a very open and inclusive organization. It's part of how we've grown.
So kind of making a pivot now, looking ahead a little bit in terms of like strategic planning. If I could ask, can you share maybe some of RCPA's strategic goals? I know that can be tricky sometimes to plan too far ahead, as fluid as our system is. And you've already touched on, some of the priorities you're kind of are in stream right now, but maybe near term or longer term, are there any things on the horizon you wanted to talk about?
Sure. And actually, one of the things that I've been known to say is that we're very focused on action and results, and we don't call a timeout and do a lot of strategic planning. But truthfully, that's not really the case. It's just more of a spirit of how we run RCPA.
Right.
But if I were to step back and say, so what is our strategy? Well, we want to continue to be not only an influence, which I've mentioned several times, but to be relevant. And to do that, we know that we have to continue to strategically grow. We have done that over the years, both organically as members grow and new members join, but also in strategically partnering with other associations that have become part of RCPA or partners with RCPA, that we want the safety net providers to be taken very seriously. We want to have a seat at the table, a meaningful seat at the table, and we want the funding for services to be taken seriously. So I know that strategically, we not only have to grow and be an influence and to be recognized as such, but we have to continue to deliver. It's not lost on me that we're how do we sustain ourselves? We're a not-for-profit, but we get member dues.
Right.
We also make money in a few other partnerships and things like that, but dues are a big piece. Well, that means every year people have to vote. Am I going to be part of this organization or not? And I don't lose sight of that. So it's our goal to continue to deliver. So that means every day we have to be in front of leaders, providing our membership with information and analysis, offering key webinars, both around innovation and education, and of course the annual conference, which you talked about. I'm very happy when people join RCPA because they've heard about our work, but I know that people will continue to stay only if we provide them with a product, if we're delivering. And I mentioned before that it's a partnership that providers really help by participating. And I know that there are some providers, this is true for any association, part of what I've learned over the last decade, there's a subset of the providers who join or any members who join who just get the information. I don't hear from them much, and that's fine as long as they're happy and that's what they want. There are some who are modestly involved, and there's some who are really involved. I hear from them all the time, every day. We're interacting. They're giving us lots of information. They attend our committee meetings. It's a cross section, but it's that group that's involved that really help to drive the discussion, bring things to our attention, and we appreciate that partnership and keep us relevant. And so that's our strategic plan, that we don't ever want to sit back and say, well, we're the association, people like us and we're fine. That's true today, not tomorrow. So we have to continue to look at things. And periodically, we have to, whether it's formally or informally, make sure are we on base with our constituents. Gotcha. So whether it's, a couple times we've done focus groups just to say, here's our top 10 things that we do. Is that what you want? Right. I'll give you an example. When I took over, over a decade ago, we did one of those surveys. And I was surprised to find out that traditional education, which was part of an association and is often part of an association, was not really something that a lot of members were looking for. They said, we can get training and education from 100 different sources. What we need you to do is more of the lobbying and political forcing, getting us in front of leaders. So that was part of what drove that decision. We still do lots of educational things, but more around bringing products and innovation and ideas that maybe members haven't seen. So it's going to be something unique. But a traditional, here's a best practice in this clinical area. We do a little less of that now because people haven't asked for it. They're getting that elsewhere. So we shifted our focus. That's the kind of thing we want to make sure we continue to be on the pulse of the membership.
So you're constantly seeking that feedback so that it can help to shape and inform the direction of the organization and how you move forward. That's again very responsive, which I think is I'm sure the membership really appreciates. And if some aren't as involved and they have certain priorities, I would imagine making them aware, hey, this is an option for you to come and share what's going on with you, and then let's see where that fits in and see what we can do to support you.
Exactly. And going back to the whole strategic planning, I'll give you an example. Tomorrow I have a staff meeting, and we try to do this every few weeks. All of the directors, our administrative staff, membership, everyone, communication staff, just to touch base on what's going on, because being a large organization, each division is almost run as its own organization with its own CEO. It has to be. So we're very, we give a lot of leeway for each division to be out there doing what the membership needs. So when we have a staff meeting, there are certain specific issues that any staff meeting would have, but a lot of it is really a mini strategic planning. Are there things we're missing? Are there things we should be doing? So by having it that way, I feel less of the need. We better have a strategic retreat and formally meet for a few days, because we're doing it all the time as we operate. And sort of a different way to view it.
Yeah, and I think it's again a great approach to be. It's ongoing. You're always in that strategic planning mode, and I think that probably allows you to shift gears and be pretty flexible in terms of changing directions if need be, and being as responsive as possible. So that's great.
And now, a brief word about RCPA. If you are interested in learning more about RCPA, check out their website at www.paproviders.org. There you'll find everything you need to know about the organization. Again, the website is www.paproviders.org. And now, back to the show.
So, and stepping back from Pennsylvania a little bit, I know that you're on the board of the National Council, which is, I think, based out of Washington, D.C. And this probably gives you the opportunity to speak with some of your colleagues from around the country and maybe even compare notes. So I'd be interested to get your kind of take on how that helps to shape, what you do and your approach. And if you can as well, on this podcast, one of our focus is stigma specific to mental health services and treatment. To try to make a positive impact through this podcast and these conversations. So I would be curious, as a part of your response, to hear if there's any conversation related to that, and any view or perspective on are we making progress? Have we moved the ball down the field at all as it relates to stigma and mental health, and just generally how that participation for you with that board allows you to get even a bigger picture than just here in Pennsylvania.
I'm sure. Yeah, it's being part of the National Council has been a tremendous experience, and I'll get into that. But just to even step back farther, one of the other changes we did over the last several years is we have created strategic alliances with two particular national associations. National Council being one, which is for behavioral health, mental health, substance use, although it does dip into some IDD, intellectual and developmental disabilities, and Anchor, which is really focused on intellectual and developmental disabilities, such that if you join RCPA, you're automatically a member of those two national associations. So all of their materials, discounts, their conference, it's as if you join directly, and that's a really a massive opportunity and savings for members. It was a financial investment on RCPA's part, but we really thought it was worthwhile. Now, we are part of some other associations, like for medical rehabilitation, which is a division, and we have a pediatric rehab division. So we have a number of other ones, but the two strategic ones at this point are those two. I have two ways I interact with the National Council. One, as an association exec, the CEO, I have regular meetings with all the other states, all of my counterparts. Okay. And that's been invaluable in terms of the management of an association, the running of an association. How do you do your annual conference? How do you go about developing different committees? What are you doing for diversity and equity and inclusion? And have you created a special committee? And just literally learning about how, even I mentioned we have a lot of business partners, but how are you structuring some of those agreements? Are you getting royalties from these kinds of things? Are you giving members discounts? So it's been a lot of fun and very valuable to meet with my colleagues. Now, being on the board of directors, it's a mix of association execs and CEOs of agencies from around the country. And again, we meet quite often, both in person and virtually. In just a week or so, I'm back down in Washington for a couple of days for a board meeting. And that's more where we get into some of the dipping into some more of the detail about how does your state deal with some of these things like stigma? What are some of the initiatives? What are some of the innovative programs and ideas? How have you had the discussion with legislators to address that? Right. And even, Pennsylvania is a unique state. Now we have areas like Philadelphia and Harrisburg and Pittsburgh. We also have a tremendous rural area where, as you well know, we're a battleground state. So we have a mix of Republican and Democrat. So how are other states dealing with that kind of mix? And are there certain things you're tailoring? So I just have really loved the opportunity and to meet with colleagues. as a quick example, just last week, I think I mentioned to you as we were preparing for this, I came back from almost a week in Alaska.
Yeah.
Which was, how could I say no to that? But my counterpart in Anchorage said, we're first developing a lot of these things. We'd love for you to come up here and just talk with the board at our retreat about what you're doing, what we're doing. Are there areas that we could come together? And it was a great experience, learning more about what they're up to. Now, in terms of stigma, and it is a large part of our discussion, both formally and then just sort of embedded in a lot of what we do. Because if you're talking about meeting with leadership, education, providing material, I mean, that's what you're doing. You're addressing stigma.
Yeah.
And it certainly still exists. But what RCPA and our providers spend a lot of time doing is educating the public and those empowered in the government on all these issues. And when I say educating the public, some of the things we do that I haven't even touched on is getting placements in editorials in newspaper or online media, doing things through our social media and Facebook and LinkedIn, getting the message out, getting information out. Because each time we do that, I think we're chipping away, and all of this education brings awareness, which I think reduces stigma and brings hope. I also think what's happening over the years is the growing realization that we're all impacted. And what I mean by that is every meeting I go to, there's someone in that room, typically a lot of us, who have somehow been impacted by mental health, by substance abuse, or the opioid crisis, obviously, by autism and intellectual disabilities, physical disabilities and aging. You're not going to go to a meeting of whether it's legislators, leaders, providers, that people don't have their own personal stories.
Yeah.
And allowing people the ability and comfort to talk about that is how we realize that we can have that open discussion and stigma slowly goes away. And I will certainly be honest, people who know me, as I'm not immune to that. My family has certainly been impacted in a number of ways. And even just yesterday morning, I had a meeting with 4 different legislators. Now, that meeting was around intellectual and developmental disabilities, and it certainly wasn't about me. But there was an opportunity to say, well, the reason X, Y, and Z is important is take my situation. That would really impact it negatively. If we could really, it kind of puts it in a different light for the legislators.
Yeah.
So it's not all about personal stories to reduce stigma. It's also about data. It's also about larger issues. But I think it does help to personalize it and bring it home that we're not talking in a vacuum. We're not talking philosophical. This is real life that we're talking about.
Yeah, and I think you're 100% correct that it's the combination of the personal story along with being able to present an objective picture that's based on data and information. And I think both can be very powerful. And I like the way you describe it, kind of, I think we're chipping away. And I kind of say that every episode, that is one of our primary missions of this podcast. I think just by having these kinds of conversations when folks are listening, hopefully it helps them to maybe think about having a conversation. And I think the more that can happen, I think overall people get a little more comfortable having these conversations because, like you said, so many of us are impacted by these issues. It just makes sense to communicate about that. And then from there, be able to take some action and move things forward. And that circles back to what you mentioned earlier on, which is things like, let's get some more funding. Let's be able to really put a spotlight on some of these needs and things that we can do to make a positive impact. And so I think it's all connected, really. And I couldn't agree more with kind of what you were saying about the personal and the data side of things. As we're wrapping up, and if you could think about this, and this is a tough question, so we try to, at the end of each episode, ask our guest if there was one thing that they could leave the listener with, and we've covered a lot of ground, so I really appreciate your time, certainly. But if there was one thing that you wanted folks to walk away now knowing about RCPA, what would that be?
It is an interesting question. And I think often describing what it is we do. Now, obviously, given your background and the people who be listening to this, they sort of get it. But I always think about when if I'm on an airplane and someone says, "What do you do?" It's a little hard to explain sometimes, and who the providers are that we represent and what that means. And so the one thing I try to leave people with is that I feel, and what really is so rewarding for me is that we're on the quote right side of the equation. But what I mean by that is I understand, and we understand that there's limited funding for everything. You don't have limitless funds. But we're fighting for those with the most serious illnesses and disabilities and helping them and their families and through the providers we represent. And I think that's important work. And it's what keeps RCPA going. And it's certainly what keeps me going. That I know that over the last probably 30 years, public sector human services has been woefully underfunded. So when we get something to move forward and better legislation and better funding in a given area, that really is critical. Now, of course, explaining to the government why the next year you need even more funding, because they often say, didn't we just give you? Right. But we're making up for the past 30 years.
Right.
And when we succeed, I feel like the providers and the people they serve are helped. And so all of this leads to better quality and access. So if I were to sum it up, I'm happy to be sort of fighting this fight on behalf of the providers and those who need, those individuals and families who need help. And that's what I mean by being on the right side of the equation.
Yeah, I think that's a great message. I think it does help to illustrate those of us within the system, kind of what our overarching goal is to fight for those that we support and provide the services for or the supports for, and for those outside of the system to be aware of that, to just raise that awareness, I think is a very helpful message, and a hopeful message. So I really appreciate that. And I also thank you for taking the time to talk with us, Richard. We really appreciate your time and this information. It's been very informative for me. I've learned a tremendous amount on this episode talking with you. And I really can't thank you enough. I wish you the best with this year's conference and all the work you guys are doing and all of your work going forward.
Well, thank you, John. I really appreciate the opportunity and Magellan as well for setting this all up. Thank you.
Stick around. We'll be right back to wrap things up. So what did we learn about on this episode? Well, we learned about the history and mission of RCPA here in Pennsylvania and just how much the organization has grown over the years. We learned about the work they're doing to support providers and to advocate for policies to help those in need. We learned that they actively engage with their members and serve as a forum for the exchange of information and to provide support to their members through a variety of ways, such as their annual conference. And lastly, we learned that if you are interested in getting more information or getting connected with RCPA, you can check out their website for all kinds of helpful information about the organization, including how to connect with them. We'd like to thank our special guest for this episode, Richard Edley, President and CEO of RCPA, for joining us and helping us to learn all about RCPA. We'd like to thank all of you for listening to this episode of the podcast and invite you back for our next episode. And remember, if you have any questions or feedback about the podcast or have suggestions for future episodes, please send me an email directly at jglees@magellanhealth.com. Well, there's the music letting us know we've come to the end of another episode. I'm your host, John Lee, saying goodbye for now, and please remember, behavioral health matters.